Vanakkam, Namaste, and welcome to Dr. Shah's Clinic. In this short video, we're going to discuss on the safe days to avoid a pregnancy. Now, say if you're recently married or you're into a new relationship, you probably want to lower the chances of an unwanted pregnancy or an unintended pregnancy. Now, what's important to understand here is that a typical menstrual cycle of a woman, will last anywhere from say about 28 to 32 days on an average. And the fertile window period is usually in the middle of the cycle, right? Somewhere mid-cycle, that's all we know, right? Somewhere between the 10th day to the 14th day or the 15th day in a typical 28-day menstrual cycle period for a woman. So a quick method that you can use to ascertain whether you should have sexual intercourse with your partner today or not is by asking two simple questions, and this is the quick start method or the two-step quick start approach to preventing a pregnancy, right? And this is a NFP method, right? It's not a typical contraceptive approach. So you have family planning methods, and then you have the other types of methods that involve basal body temperature or that measures the cervical mucus secretion and a lot of ranging factors. So these two simple questions that you must ask your partner are: first, did you have cervical secretions today? That's the first question. And the second question is, did you have cervical secretions yesterday? Now, if the answer is yes to both questions, that is, did you have cervical secretions today? Your partner says yes. Did you have cervical secretions yesterday? The partner says yes. Then that means she is fertile and you should avoid intercourse, specifically on the day you are asking your questions. Fair enough? So say your partner's bleeding got over. Say that you have 5 days that are days of bleeding, right? In a typical 28-day menstrual cycle, you have a 5-day bleeding phase, after which you probably would have intercourse. So every day you have to ask her the question: did you have cervical secretions today? Did you have cervical secretions yesterday? And if the answer is yes, she's probably fertile, avoid intercourse. And if the answer is no, did you have cervical secretions today? The answer is no. Did you have cervical secretions yesterday? And the answer is no. Then she is assumed infertile. That means the egg release is not yet happening, or is not going to happen anytime soon. Then you can have sexual intercourse on that day. Now, this method has been tested and validated with a couple of studies. And what's very interesting here is that the pregnancy prevention rate is probably around 75 to 83%, right? And you have to the only issue with this method is that it's not invasive, right, in one sense, but you have to ask your partner these questions on a fairly regular basis and then plan the intercourse. So on an average, if you ask these questions, you would note that in a 28-day cycle, somewhere between the 10th day of the cycle to the 18th day of the cycle, you probably won't have intercourse. So the method actually correlates well with the calendar method of contraception. So I hope you like this video. Please use this method. Please try it out if you're not planning for a child. And please like, comment, subscribe, and share this video with friends and where relevant. I hope I'll see you soon with other videos. Please do like, comment, and subscribe. This is Dr. Shah signing off for now. Vanakkam.